Okay, a little bit about myself. I'm Carissa Wood. I am, uh, my experience with de-escalation is I am currently a trainer for the entire Iron County School District here in Cedar City, Utah. So that is 17 plus schools um, here, all the way from preschool through post-high. So that's about when students are about 22. Um, we deal with quite a variety here. I've also, and I'm also involved with the school psychologists and behavior specialists here. I have also worked hospital and inpatient and been involved with emergency and safety responses at hospitals and other places. So I've been involved with behavior and de-escalation. I'm also a mom. So been practicing that for quite a few years with the kiddos. And I have also I'm a trained competition soccer coach. So lots of de-escalation situations in over those years. I've been one for about 15 years now. So I've had a lot of opportunity to practice de-escalation. So hopefully we can um, together discuss some of about de-escalation and we can all learn something today. So this is specifically de-escalation with and then added with a substance use disorder echo. It is supported through the HRSA RCorp Psychostimulant Support Grant. So think great that they are supporting um, our efforts in this. Okay, so let's start. What is de-escalation? Does anyone want to comment? This is going to be a lot of discussion based. So hopefully, if you want to participate, great. If you don't, great also. But what is de-escalation? Does anyone want to answer?
I'll answer.
Thanks, Sabrina.
I don't know if it's right,
You're
but
fine.
I guess bringing someone from a state of agitation or anxiety to a state of calm or more peace, I guess. I don't know. It's my best
Perfect.
guess.
No, that's a great, thank you. The literal definition is the reduction of intensity of a conflict or potentially violent situation. So, absolutely, that is the literal definition of de-escalation. Um, it is also a communication technique. Now, when you think of communication, like usually we think verbal, but what are some ways that we communicate nonverbally? Like I'm communicating now with my hands because that's a nervous thing for me. So sorry if they get in the way of you guys, but I can't stop it.
Our posture.
Yes, absolutely. Our posture, whether we're folded hands, how we're standing, if we're facing away. Thank you, Shelley. Ah, I'm rolling forward. Any other comments? Um, we communicate nonverbally constantly through how we move, our facial expressions, how we listen, our appearance, how we're dressed, how we present ourselves, objects we touch, how we touch them, how we move around things with things, how we dress. They're all some of examples of the way we communicate nonverbally, and they all play into de-escalation. So why is it important to learn de-escalation? Well, we can use it in everyday situations. Like I talked about, I've had years of experience with it, learning it and learning to be better at it and practicing, because that's the only way we get better, because no situation is the same. But I use it all the time. I use it every day, from parenting, dealing with coworkers, customer service. Um, you use it every way. You can use these tools. It doesn't always mean de-escalation doesn't always mean a situation that is high escalated. How we present ourselves, how we're talking to people, we can keep things de-escalated every day. And it creates a sense of empowerment. It helps us learn and create solutions versus just saying problems. There have been times like something escalation or conflict or anything like that. All I see is the problems is just overwhelming, all the things. This gives a sense of empowerment. I can see it as a different situation and can see solutions versus problems. It helps us recognize the severity level of escalation, and especially in dealing with persons with substance use disorder. It's important to recognize quickly what level of escalation we're dealing with, or recognizing someone that could possibly potentially be escalating. It works. Um, I have never, I mean, not that it works 100% all the time. It is not a 100% guarantee ever, because we all are people and people can make their own choices. But it does work. If it doesn't help the person with it, at least it can help you. It can help with safety. It can help. It does work. Every study done about de-escalation shows it's effective. I could pull some studies, but pretty much every study studies have been done in such a wide range of who they've studied and where they've studied, from police forces to customer service and everywhere in between. All of them showed that there was a reduction in the level of escalations, showed prevention, and showed the decrease. There was a decrease in the severity level of interventions needed. It was dependent on the situation, the level of success, but ultimately it shows that de-escalation does impact positively. So goals when we're using de-escalation. The goals we want um, are, the number one is safety. We want to be safe, and we want everyone around us to be safe, and we want the person being escalated to be safe. Is prevention. We would like to, you know, if we can, a lot of times, dealing with a lot of the situations, using de-escalation prevention strategies prevents escalating to dangerous levels. We want to facilitate a positive outcome. We absolutely want, um, when we're using de-escalation, to create a positive outcome for everyone. And going along with that is building trust and rapport. When we are de-escalating someone, or in a situation where de-escalation, whether it's us, someone else, there's a relationship there. Whether it's with a customer service, there's a customer, and uh, you're the customer and the customer service representative. There is a relationship there, no matter what, and you want to build trust and rapport in those relationships, especially if you're seeing clients, if you're seeing patients. You don't want to hurt your relationship. You don't want to create distrust. So when using de-escalation, we want to make sure we're building trust and rapport. Offer choices and solutions. Choices are a very powerful tool in de-escalation. They avoid you telling people what to do, which can escalate someone, and providing choices helps the escalated person to feel a sense of control. And we would like to give that back to them, because that creates de-escalation and ultimately to avoid violence. So, topics that will be discussed in this series, I just want to go over this really quick. How to prevent crises, escalation, and potential violence, how to provide solutions and choices, learn how to assess and manage a tense situation to minimize. Well, let's see where I'm at. A tense situation to minimize the escalation, to be able to provide support to individuals who may exhibit disruptive or dangerous behavior, how to create workable safety plans for the safety of you and others. We will have a day with law enforcement comes and they talk about their role in Good Samaritan laws, what to expect from them, what their trainings are, and what they would like for you to help with your safety plans and everything else, and when they want you to call. One of the most important things that gets overlooked a lot, recovery after an incident. One of the most important things after a de-escalation incident or an escalated incident is to talk about what happened before, what happened during, and what happened after, and what was great, what could be done better, what needs to change. Those are your learning moments to get better. I don't feel like any situation with de-escalation is ever a failure. I feel like they're always something we can learn from, always something we can grow from, and that taking those opportunities to do that is really important, especially when you're working together as a team. So you're all on the same page. And then resources. This is just going to be kind of an overview of it and just touching into like what de-escalation is and all the different parts of it. For more in-depth training and resources, we will have a list for that at the end of the series. So first starting off, de-escalation, it's about behavior. So understanding behavior is one of the most important aspects of de-escalation. So all behavior is communication. Don't take it personally. You're gonna hear me say that a lot. It's really, really hard to not take someone's behavior personally, especially if they're saying things to you specifically like I hate you. You're like all the like you like just saying things that sound like they're for you, but really it's not about that. Or thinking because of their behaving that they are bad or just trying to make you mad. Usually someone's behavior doesn't have anything to do with you. And remembering this will help you stay in a frame of mind of de-escalation. So trying to understand why people do all the things they do could have us here all day. But for the purposes of the de-escalation, we're going to focus on the four functions of what the four functions of behavior are. So the first one, oh, or the second, third, fourth, attention. Um, attention, which is basically usually trying to meet a need. So whether it's a basic need or what they're wanting right then, they could be the behavior could be because they don't feel like they're being heard. Avoidance, escape. You are asking something for them that they're trying to avoid, or they're not really wanting to be there, but they're there because they have to be. So they're going to create escalation to be able to avoid it. Tangible reward, the escalated behavior gets them what they want, whether it's removed from the situation or attention or whatever, but they're getting rewarded somehow. And then automatic. So our habit, that when they are in these situations, they are used to this is just how they behave, and that hasn't been de-escalated or taught differently yet. This is also an opportunity during de-escalation. It's not a time to teach. After is usually, so that's part of fostering that relationship and that trust and building that rapport is if it's a patient or something, once everything is de-escalated, they're back to a rational mind where they can learn, then talking about, okay, when this behavior happened, this is what it created. How about we try these options next time? So we'll go into more than that in a further section. Trauma-informed care awareness and practice. So that is something that's really important. Approaching behavior with the trauma-informed care approach, because remember, everyone is going through something. And also recognizing that your own trauma can be playing a role in the de-escalation is important too. So hopefully most of the time you're not alone when you're trying to de-escalate someone. And if you're just realizing that person is just not um, like you just can't handle the de-escalation, you can ask for help. A lot of times we feel like we have to be the person that does everything and helps everyone, and it's okay. It's okay to ask for help on these. We want to shift our thinking from what is wrong with this person to what has happened to this person. It's really important that when we're dealing with behavior, um, that we take this trauma-informed care approach instead of thinking that they're just doing things to um, um, not that they're just trying to do things that to make you mad or to do things like that there's something wrong with them. But truly it is, we are not, our behavior shouldn't define when we're dealing with them. Yes, their behavior is separate from the person, and that's what the trauma-informed care helps us. Recognizing the presence of trauma symptoms and acknowledging the role they may play in behavior. So when we're dealing with patients and you know some of their trauma, or just know, or you can recognize some of the behavior might be trauma-based, is really important part of de-escalation. And then factors that can affect behavior. There's many factors that can affect it. I'll talk about some and then we can talk about each of them individually. So let's start with substance abuse disorder. What about substance abuse disorder, substance use disorder? Oh my goodness. I am so sorry. Yes, I'm nervous. Um, what, how would that factor in and can affect behavior?
Well, it changes judgment, for
Uh,
one. It makes your thought process, it makes sure it dysregulates mood. and it doesn't give you, drug use doesn't give you a very like linear and logical thought process. So that's
Absolutely. Absolutely. Veronica wrote altered state of mind. Yes. You, if someone you're wearing someone is under influence of a substance, yes, they're not in a rational state of mind typically. They're not going to react normally or and they're going to be really unpredictable and irrational. So, yes, trying to not factoring in a factor that can affect their behavior can make your de-escalation be less successful. So that's why we want to make sure that we're thinking of all the factors that could help. So development and lifespan, where they are in their development or in their life, how could that affect behavior? So like what stage of life, like if they're trying to learn to meet basic needs or if they're losing their independence. Losing your independence is a big deal for a lot. So if they're um, getting older and a lot of things comes along with that, that can affect behavior and create escalation. Conditions and diagnoses. What are some conditions or diagnoses that can, I'll go with the easiest one. Getting hangry, being hungry. That is a real thing and it will de-escalation level or the escalation of level that sometimes is huge. And that could be, their basic needs aren't met. They're hungry. Pain. Pain is a big one that can alter people's behavior and affect people's behavior. A med change. All of a sudden they're having um, feeling totally different because some meds have changed. What would be some diagnoses that would affect behavior?
Alzheimer's or dementia, uh, developmental delay, uh, any type of issue like that, mental retardation, that sort of thing. So
Absolutely. And sometimes we are interacting with people and we don't understand that, but trying to recognize what could be what you're dealing with is really important. So that I know that puts a lot of on us as those of us trying to do de-escalation, but as you practice this, it will get easier and easier when you start recognizing. But yes, any sort of neurological or mental illness, your bipolar, schizophrenia, anything like that, autism, ADHD, all of those can affect behavior. Trauma, um, if they're feeling unsafe, because it's triggering some trauma or some situations for them, trauma is always a big one that can affect behavior. What, like social and environmental, what of those can affect behavior?
Large amounts of people, big crowds.
Absolutely. Um, so like social or environmental, also their culture. A lot of times we perceive something as a slight or a disrespect when it's part of their culture. So trying to understand cultural differences also is important. Um, Identity or learned racism, like things they've learned growing up in their environment, is also something that can play into into their behavior too. So as much as we can know about someone, the better we can know how to de-escalate and where their behavior is coming from. And then some strengths and um, let's see, where would we at? Strengths and limitations. So like domains of functioning. Um, what could be being affected? Like we already talked about Alzheimer's and stuff like that. So like cognitive abilities or memory. You were talking about being in crowds, so sensory, and attention, and then like impulse control, stuff like that. Just knowing what's going on can help us. Okay, some causes of escalation. So anybody offhand, what are some causes of escalation? Shelley already mentioned crowded room. Absolutely.
being told that you can't have or not gonna get a controlled substance.
Absolutely. Absolutely. That's yes. Um, I'll put some up. Feeling unsafe, ignored, disrespected, fear, anger, overwhelmed. Um, they're misreading body language that's around them, poor communication, facial expressions, crowded environment, being asked to wait, lack of empathy, overstimulation, being touched without permission, or like being surprised with a touch. That's especially trauma based, under the influence of some sort of substance. And one of the big ones, which you're going to hear me say too, is being told to calm down. And I'll discuss that really quick. Being told to calm down, the reason that never works is because it is not a direct um, uh something that directly they can do. Like, great, calm down. How? How can I calm down? Let's see, I've got it. Oh, yes, overstimulation. If someone was in a completely new settings to them, yes, I will try to make sure I pay attention to the chat. Sorry, guys. Yes, but saying to calm down will never work because that is not something direct they can do. They need to have other things told. They're not in a state of rational mind or direction. They need things simple. That saying calm down is a complex thing. So, um, those were all great. Thanks for all the comments. And then we talked about what are ones that are specific, some causes of escalation to persons with SUD. So being told no from Sabrina, that they're not going to get a controlled substance. Absolutely. So we could be prepared for how to deal with that. What are some other ways? What are some of these other of causes of escalation that are specific to persons with substance use disorder?
I have seen a very negative reaction to the word addict, or if you call them an addict. The use of
Yes,
the word upsets people.
yes. Being stigmatized, using our language, absolutely. What we say to them is huge for them. Um, those are great. You guys are doing great. Thank you. Let's go to signs or signals of escalation. Now, part of de-escalation is recognizing when someone could have either the potential to escalate or that they're starting to escalate. Oftentimes, escalation doesn't get noticed till it's, you know, like they were starting here, but they finally get dealt with here. That's a lot harder than if we can start here. So recognizing signs or signal of escalation is really important. Let's see. So, some signs or signals of escalation that you guys have noticed or you've seen in your life. I'm going to put some right there too. So, like a change in mood, pacing, clenched fists, fidgeting. So, angry facial expressions, changes in any baseline behavior, changes in levels of anxiety, shifts in tone and type of speech. If they start doing some level of self-harm, that can be pinching themselves, hitting themselves, starting to bang their head. Um, One of the things we teach about de-escalation is making your area safe, and we'll talk about that later because people can turn almost anything into a weapon. And so, noticing they're starting to do anything like that, giving very short answers, yes, starting to act really abruptly. Concentration problems, like suddenly they're starting to not be able to remember or acting confused. Shifting eye contact, becoming really watchful or hyper vigilant. Um, Disorganized behavior, jerky, uncontrolled movements, verbal threats, banging, staring, avoiding eye contact, threatening gestures, rapid, deep breathing. These are just some of the many signs of de-escalation or signs of escalation that they're telling us start paying attention. Um, of signs or signals of escalation, what are signs you recognize with persons with substance use disorder? I'd say probably
I've
like
seen people detach.
yes, absolutely. Suddenly they're just gone. Thanks, Shelley. That's a really good one. And I didn't have that written down. Thank you. Yeah. Disassociation, absolutely. That could be trauma too. Trying to think. I noticed the hypervigilant. I've noticed that at times. The disorganized behavior or jerky, uncontrolled movements. Um, Trying to think. Sometimes it's the concentration problems too. Sometimes they're not huge. They're just slurred speech or something, and then they can switch just really quickly. That's what's crazy is that also in the with escalation, de-escalation is that the escalation can happen just really quickly when you're dealing with someone or a person with a substance use disorder, and it can have no rhyme or reason. A lot of times we can see a lot of signals, sometimes they're not there. Okay, the role of stigma in escalation, as we were talking about, as Shelley mentioned, being called an addict or something like that, that can um, escalate someone. So let's talk about the role of stigma. Stigma is a set of negative and often unfair beliefs that society has about something. We see it socially, we see it in the media, we see it, like groups of people, everything like that. Um, it is labeling, stereotyping, and discrimination. One example is using disparaging or judgmental terms to refer to addiction, people with substance use disorder, or treatments for the disease. Using terms influenced by stigma and negative bias will influence escalation. So the language we use is a very, very important part of de-escalation and being aware of our language, um, because we could be saying it in the right tone, we could be saying it in the right way, but the actual words we're using are what is contributing to the escalation. So how can stigma escalate persons with SUD? Stigma about people with SUD includes inaccurate or unfounded thoughts. So thoughts people can be having when encountering a person with SUD, is they're dangerous, which yes, sometimes they are, but not all at fault for their condition, incapable of managing treatment, and using stigma dehumanizes someone. Can make them not a person in your mind, which can be really dangerous. What stigmas have you guys noticed of about people with a person with SUD that there are?
Like Shelley said, the word addict is used a lot in our community. I mean, it's changing. We're getting better, but the word addict is um, used. The other thing that ends up happening is seems to be this well, I don't know what you would call it, but this idea that once an addict, always an addict, and that's just not true, or once untrustworthy, always untrustworthy. So that happens in our community a lot.
Absolutely. And those are big stigmas. Thank you. Um, what about self-stigma for a person with SUD can have about themselves that they could be projecting or feeling like anything you say or do is with their self-stigmas that they are feeling. Um, Anyone want to take a shot at that? What are some self-stigmas a person with substance use disorder can have? Because I'm sure you're going to say something that I'm not listed. So
They feel hopeless. They
absolutely.
feel worthless. Um, yeah. And then I think somebody in here, it was Sean,
Oh
it's just
yeah.
tons
Yeah.
and tons of shame.
Yes. Thank you. I forgot to look at that. Let's look at shame-based, not productive. Absolutely. Sometimes considered not worthy of help. Yes, that they're beyond help and they consider themselves not capable of recovery. They don't trust themselves. Absolutely. So shame, I put some low self-esteem. Those are all great ones. What past experiences has taught them of being treated with stigma, they take that in. When they're treated that way, then they start thinking about themselves that way. and absolutely fear they won't be treated fairly. It's so hard for them to even reach out for help that when they make that step, that they're so vulnerable and so susceptible at that time that making sure that we are not reinforcing what they already incorrectly think about themselves is important. And because of stigma, it reduces their willingness to seek treatment. And ultimately, they do want help. Most of them want help and want to seek treatment. So the fact that they're even making that first step, we need to make sure that we are doing everything we can to keep their experiences de-escalated as much as possible. So how can we make changes? Like Sabrina said, we are starting to make changes in that arena. Um, Here are some ideas. I also have a really good resource. I'm going to put um, Franco will put the resource in the chat. That's right there. It is from the National Institute of Drug Abuse site. It's Words Matter, preferred language for talking about addiction. Um, these are some of the ideas taken from that, but my favorite thing about that resource is they have lots of tables and charts on there if you haven't seen it before. And it talks about the words that are triggering, what you should use now, and why. And I really like that they have those tables. I could have put them in here and we could have made the whole hour about that, but they have lots of tables in there, lots of different situations. It's a great resource to use. So one of the most important things they said is use person first language. So using person first language keeps them from being that dehumanized, keeps them from um, not being a person, but being like a them, they, it, uh, like person with problem, like they have a problem, something like that. So using person first language helps our empathy and helps our way we're thinking about them. And then let individuals choose how they are described. If you're talking about them, you're trying to build that trust and rapport with them, talk to them, ask them what they want and how they want to be referred to and what they, you know, giving them choices. Like I said, choices are a huge tool. Person first language maintains the integrity of individuals as whole human beings by removing language that equates people to their condition or has negative connotations. Um, it is going to take time and effort. And one of the best things you can do in this situation, if I like say something incorrectly or say something not uh, not correctly, is apologizing and saying, I'm sorry, I made a mistake. Apologizing is a huge, also, I mean, it's not saying we are wrong or saying something that is not going to create, it can take all the power out of that escalating moment and just being like, you know what, I'm sorry, dude, my bad. Like I was wrong on that. So I am so sorry. And let's try again. Can have a lot of power. So for example, a person with a substance use disorder has a neutral tone and distinguishes the person from his or her diagnosis. You notice I'm using that term a lot. That is a term that we are trying to use that we're hoping will not have a stigmatized reaction. And then the great resource available about the terms to use and terms to avoid is this. Yes, I really like that resource. I actually have some of it printed out to remind me. See on the chat. Sean, asking sincere questions in order to understand better. Absolutely. Part of the de-escalation is how we listen. If we are just rattling stuff off and just like not really listening to them, that can escalate someone. So asking sincere questions in order to understand better. Absolutely. So we are actually ending a little early. I think I kind of rushed through things and intended to discuss things a little bit longer. I'm sorry. Hopefully nobody's disappointed we're ending a little early, but we're going to talk about what to prepare for next week. Um, I want to challenge you guys through this week to pay attention to how you talk to people, tone, language used, body language. I guess I could have asked you, did anybody have any questions before now about what we've discussed about? I should have been asking that all along. I'm so sorry. Anybody have any questions? Okay, so for next week, I want you to pay attention to how you talk to people. I want you to start developing a self-awareness because self-awareness is a really important part of de-escalation and something we're going to talk about a little bit more next week. So I want you to prepare for that, to start paying attention to how you talk to people, tone, language used, the reaction it's getting, um, what your body language is saying. Um, Oftentimes I will get asked, "Are you mad?" Because I'm concentrating so hard. I'm like, I make this face when I concentrate, or when I'm thinking about something, or I have like multiple things going on in my head, and I'm always asked if I'm mad, and I'm like, no, I'm not mad. But often that, like our body language or how someone is suddenly acting around us, maybe we need to be looking like, oh, I have my arms folded, my head's down, I'm not interacting at all. So just paying attention to all of your body language, how you feel when you're interacting and there's any sort of conflict. And it could be just like it's something you didn't want to really do, or, conflict isn't just the word conflict. Sometimes I feel like people think it needs to be this big, huge, like explosion thing, like a bomb going off. Conflict is just when there's any sort of dysregulation in feelings and difference of opinion, stuff like that. There can be a level of conflict. Conflict doesn't necessarily need to be negative. It can be a positive conflict too. It's just how we interact and how it's treated and what we do with it. So, how you feel when you're interacting with conflict? Is there feelings there? Does it bring up like past stuff? Like when you're dealing with any sort of conflict, does it bring up a lot of past stuff? If you're emotional, reflect to as why, like what kind of emotions am I feeling? And is it really with what's happening right now? Or is this um, just stuff from me? If interacting with an escalated person, observe what their behavior is communicating. So if you are encountering anybody escalated, try and see if you can discern what their behavior is communicating to you. What role stigma is playing in your life and how you interact with others. I have things I still need to change constantly. I correct myself constantly still because I realize, oh, that did not come out how I wanted that to come out. That how I said that was not what I was thinking or meant. Just paying attention to how that is and how that could be affecting for escalation. And then as you go through the week, if there's any questions that come up or you might have and you want to discuss, I'd like to open that up at the beginning of next week to discuss anything if you encountered something or if you wanted to talk about something. Um, at the beginning, I'll make time to make sure that we bring up anything or discuss anything or go over anything like, oh, yes, that was talked about last week, but I just want to go over it again. That would be great. So, how's everyone feeling about the start of de-escalation and behavior? Yeah? Was it helpful? I really loved all your comments and everything you guys said. Um, was it like, is it something you guys all know? Like some of you guys have had de-escalation training to a degree and stuff like that. Is it something you've all heard before, or are we like, is it creating maybe some changes that can be made?
Yeah, I mean, I think so. I looked at that website from the NIH and I mean, I use the term alcoholic all the time. I
Hmm.
didn't know it was stigmatizing. So,
Oh, good. I know that's such a great resource. It
mm.
teaches way better than anything I could do about stigma. So, well, great. I'm hopeful that this will be, I feel like bar training that I do with de-escalation, we go all the way to physical management. I feel like you know, it's a lot longer and a lot more in depth. So I'm just hoping we can give enough. Something we talk about in therapy often, but there's always room for improvement. Yes, always. There always is. So, thank you. And you guys were great. And I loved all your comments. So next series will be on the 18th, Thursday 18th. And it will build our next session at noon. It will build on already what we were talking about today, and we will be addressing self-awareness and how to be more self-aware and what we need to pay attention to self-awareness. We're going to talk about the different of severity escalation levels. Um, Part of the ultimate thing of de-escalation is to create a safety plan so you know what to do. And so recognizing what level of severity escalation you're dealing with is very important. And then I create it as like a de-escalation staircase. We're gonna have somebody come talk and they're gonna use like a series two of I like the idea of the staircase though because it gives me like steps. And then I know that the steps are important to like Like, here's my staircase. Here's to the ultimate violent crisis. Here's to calm. I know we're here on the staircase, so I know there's, several steps I need to take to be able to, de-escalate the situation. I just like that visual in my head. If that helps anyone else, great. If not, you can create your own little idea of that. Some de-escalation do's and don'ts. What's been proven to work? What's been proven to escalate? Um, some things will may surprise you because things you're like, oh, that was super helpful. I would think that would be super helpful when actually it could be getting the opposite result that you want. Incident minimization. We've already talked about some of that today. Recognizing behaviors and stuff like that is so we don't even create the escalation that could potentially happen, especially with those we know are prone to escalate. And then just some basic de-escalation strategies. What are things we can use? So hopefully those will be things that'll be helpful. I'm excited about it. I love de-escalation. I love hearing about how it helps people, and I love hearing about situations. And so if you have success stories or something like that, I would love to hear about those also. But yeah, so we're prepared for next week. Any questions or anybody have any comments about today? See, we're ending about 10 minutes early. Hopefully that's okay with everybody. Well, thank you. And we look forward to seeing everyone next week if you can make it. We appreciate it. Bye.